So you are doing spinal cord stimulators. What type of pain is this good for, and how does it work?
Well, spinal cord stimulator is like a last modality of treatment, and many of these patients already had surgery, and we have tried multiple interventional techniques as we have described over our interview. So it is the best suited for low back and leg pain.
Low back and leg pain.
That's correct.
Like what kind of leg pain? Like it's shooting down the leg?
In the past, that is what we used to think. Neuropathic pain is like more than shooting pain. It's more like burning pain and also shooting too, but burning pain was the...
Burning, okay.
Because it was coming from post-surgery syndrome where they already had 3-4 surgeries, so there was some amount of nerve damage. So we were thinking that it was neuropathic pain. But now with the development in the technology, we are able to offer this service for low back pain, and also the radicular pain or nociceptive pain rather than neuropathic pain. So we can do that for several types of these things. So for the low back pain, we can offer that for low back pain, leg pain after surgery. Sometimes we can do it even without surgery.
So how does it work? So it's like, it's an implantable device?
It is a device which is implanted. First you have to go through a psychological evaluation before we do anything. That patient is satisfied and acceptable for this type of situation, and then we do a trial. So we put 2 leads into the thoracic spine area and then send the patient home with a stimulator. There is a patient...
So it's an electronic stimulation that hits the nerve and interferes with the signal going to the brain for pain.
That's
like
correct.
Interrupts it in a way.
That's correct.
Interesting, okay.
So we try them for 5 days or sometimes 15 days and see how patients are able to tolerate as number one. Some people hate it because it is stimulation in their body.
Like it tickles in a way?
Sometimes it does.
Okay.
And sometimes can give you shocks. But if it is done properly and you have a good rep from the company, and it does very well, and we watch them. And after that, if they get about 50 to 60% relief or better than 50% relief, then we can go ahead and put a permanent implant. In the permanent implant, we put the leads again, new leads. We don't keep those. They are taken out, and we have to wait at least 2 weeks before we do the permanent, and then put 2 leads, and then put a permanent implant, which is a programmer. It is a battery replacement. And that is how they control it. And there are 2 types of them. One is the rechargeable battery, the other one is a non-rechargeable. If it is non-rechargeable, you don't have to do anything. It is there, you can control the stimulation. If it is rechargeable, then you can charge it every day, every other day.
And for some people, this is a complete pain elimination? Have you ever met that patient?
Oh yeah, I met several of those patients. If it is a single region pain, they are having pain only in the low back. And this works, and it is complete relief. They don't need any medication. If they need very little medication and they're functional, some of them go back to work. I have at least 3 patients who are disabled for years, and after this they went back to work.
Because you say, we had a conversation about this on the phone, that a lot of these people get in pain, they stop walking, they stop moving, then they get sicker and sicker and sicker, and death.
And then they get obese and all metabolic disorders, and they just lose interest. You may have seen in Wall Street Journal, there was an article which said that when you have a purpose in your life, you live much longer. These people lose the purpose.
Because they're in pain.
They are in pain, and they don't feel like there is nothing they can achieve.
So ask your interventional pain management doctor about spinal cord stimulation, if you're a candidate. Or just go to you.
Either way, it is fine.
All right.